Center Test Prep Exam Edge. Question 1. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: Option A, damage above the midbrain. Option B, damage at or below the midbrain/brainstem. Option C, damage to the cerebral cortex. Option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Decerebrate posturing, abnormal extension, arms adducted and internally rotated, legs extended, indicates brainstem damage below the level of the red nucleus and carries a poorer prognosis than decorticate posturing. Question 2. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. A holosystolic murmur at the apex radiating to the axilla is characteristic of acute mitral regurgitation, often caused by papillary muscle rupture, a mechanical complication of ME. A VSD murmur is typically heard best at the left sternal border. Question 3. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The nurse should instruct the provider to immediately stop the procedure to reduce vagal stimulation and prevent syncope. After the procedure is stopped, the patient can be placed supine and assessed. Question 4. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius, 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. The Osborne or J wave, a positive deflection at the J point, is a characteristic ECG finding in moderate to severe hypothermia and becomes more pronounced as temperature decreases. Question 5. Fat embolism syndrome is most commonly associated with fractures of the: Option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Fat embolism syndrome occurs when fat globules from bone marrow enter the circulation, most commonly after fractures of long bones, femur, or pelvic fractures, causing respiratory distress, petechiae, and CNS changes. Question 6. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock. Option B, distributive shock. Option C, cardiogenic shock. Option D, neurogenic shock. The correct answer is option C, cardiogenic shock. In cardiogenic shock, the pump fails, leading to decreased cardiac output. The compensatory vasoconstriction increases SVR, cool, clammy skin, and preload backs up, causing JVD and pulmonary edema. Question 7. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 8. Testicular torsion is a surgical emergency that requires intervention within: Option A, 24 hours. Option B, 4 to 6 hours. Option C, 2 to 3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4 to 6 hours. Testicular salvage rates are highest when detonation occurs within 4 to 6 hours of symptom onset. Delay leads to testicular necrosis and loss. Question 9. The hallmark sign of compartment syndrome is: Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 10. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, dry skin and absent bowel sounds. Option C, hyperreflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperreflexia, clonus, and agitation. Serotonin syndrome results from excess serotonin and presents with a classic triad of mental status changes, agitation, autonomic instability, and neuromuscular hyperactivity, hyperreflexia, clonus, rigidity. Question 11. Meningitis is an inflammation of the: Option A, brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Meningitis is inflammation of the pia mater, arachnoid mater, and the cerebrospinal fluid within the subarachnoid space. Encephalitis involves the brain parenchyma. Question 12. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive for fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all for fluids. The correct answer is option B, keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation, and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 13. The antidote for acetaminophen overdose is: Option A, naloxone. Option B, N-acetylcysteine. Option C, flumazenil. Option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. N-acetylcysteine, NAC, replenishes glutathione stores in the liver, allowing for the safe metabolism of the toxic acetaminophen metabolite NAPCHI. It is most effective within 8 to 10 hours of ingestion. Question 14. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with: Option A scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Blowout fractures of the orbit involve the thin bones of the orbital floor or medial wall and often involve entrapment of extraocular muscles or injury to the globe itself. Question 15. Sengstaken-Blakemore tube placement is used as a temporizing measure for bleeding from: Option A, peptic ulcer. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option B, esophageal varices. A Sengstaken-Blakemore tube is a balloon tamponade device used to apply direct pressure to bleeding esophageal or gastric varices when other measures fail. It is a temporizing measure until definitive treatment. Question 16. Priapism is a urological emergency characterized by: Option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, scrotal edema. The correct answer is option A, painful, prolonged erection. Priapism is a sustained, often painful erection lasting more than 4 hours unrelated to sexual stimulation. It requires emergency intervention to prevent permanent erectile dysfunction. Question 17. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a stat CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. The priorities during an active seizure are airway management, positioning, suctioning, oxygenation, and pharmacological termination with a benzodiazepine, for example, lorazepam. Restraints and bite blocks can cause injury. Question 18. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option F. Hyperkalemia. Option B. Hypercalcemia. Option C. Hypercalcemia. Option D. Hypermagnesemia. The correct answer is option C. Hypercalcemia. Citrate, a preservative in transfused blood products, chelates ionized calcium, leading to hypercalcemia, which can cause paresthesias, tetany, and cardiac dysrhythmias. Question 19. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, surgery on the wrong body part. Option D, an armor discharge. The correct answer is option C, surgery on the wrong body part. Sentinel events are serious, unexpected occurrences involving death or serious physical or psychological injury, or the risk thereof. Wrong site surgery is a classic example that requires root cause analysis and reporting. Question 20. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, immediate endotracheal intubation. Option D, neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. A GCS of 8 or less indicates severe brain injury and an inability to protect the airway. The patient should be intubated for airway protection. Question 21. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects. Option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. The sudden onset of the 6ps pain. Question 22. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. The classic triad is abdominal or back pain, hypotension, and a palpable pulsatile abdominal mass. However, the triad is present in only a minority of patients. Question 23. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, trickle deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Flail chest occurs when 2 or more adjacent ribs are fractured in multiple places, creating a free-floating segment. The segment moves paradoxically, inward during inspiration, outward during expiration. Question 24. In distributive shock, the primary pathophysiology is option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Distributive shock, septic, anaphylactic, neurogenic, is characterized by profound vasodilation and maldistribution of blood flow, leading to a relative hypovolemia and decreased tissue perfusion despite normal or increased cardiac output. Question 25. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion.